I want you to take a second and think about what it feels like to walk into a nursing home for the first time. You smell the floor cleaner, you see the residents in the hallway, and you probably feel a deep sense of guilt mixed with a desperate hope that you're making the right choice. You look at the 5-star rating on the wall and you think, okay, the government says this place is safe. But as of May 2026, I have to tell you that those stars aren't telling the whole story anymore. In fact, back in February, the federal government quietly rolled back the minimum staffing standards that were supposed to keep our parents safe. They basically said that having a registered nurse on site 24 hours a day is no longer a federal requirement. It's a massive step backward, and it means that the safety you think you're buying is now something you have to verify yourself. For the next 25 minutes, I want to talk about the secret list that the government actually keeps on these facilities, the homes that are so dangerous they've been put on a special focus watch. And I'm going to show you how to find the real data before you sign a contract that could put your parent at risk. I genuinely find it unsettling that we are even in this position. We were promised a new era of transparency, but instead we're seeing a yo-yo effect where facilities move in and out of compliance just long enough to keep their funding. If you are helping a parent transition into a home this month, you are looking at a national average cost of about $327 a day for a shared room. That is over $119,000 a year. When you are paying that kind of money, you expect a certain level of care. But since the February repeal, operational flexibility has become the new buzzword for fewer nurses on the floor. I've talked to families who were told a facility was fully staffed, only to find out that the staff included administrators and janitors rather than actual nursing assistants. This is what I call staffing ghosts, and in 2026 they are the biggest threat to resident safety. Let's talk about this secret list, because this is the most powerful tool you have. It's officially called the Special Focus Facility, or SFF Candidate List. Most people have no idea this exists. When you go to the Standard Care Compare website, you see the stars. But buried in the technical files is a list of about 500 homes nationwide that have a persistent 3-year history of serious problems. These aren't just minor paperwork errors. We're talking about immediate jeopardy citations, things like residents being left in their own waste, untreated bed sores, or medication errors that lead to hospitalizations. The government doesn't put a big red banner on the home page for these homes. They just put them on this candidate list. As of the April 2026 update, there are homes on this list that have been yo-yoing in and out of trouble for years. If the place you're considering is on this list, I don't care how many stars they have or how nice the lobby looks, you need to turn around and walk out. I want to walk you through how to actually find this information because the April 2026 refresh changed the website layout again. When you're on the Medicare site looking at a home, look for a small icon of a red hand. This is the abuse icon. If you see that red hand, it means the facility has been cited for a serious incident of abuse or neglect in the last year. But even if the hand isn't there, you need to scroll down to the Health Inspections tab. Look at the scope and severity of the deficiencies. In the 2026 system, they use a letter grade. Anything from a G to an L means actual harm or immediate jeopardy. If you see those letters on a report from the last 12 months, that is a massive red flag. It tells you that the flexibility the government gave them in February is already being misused to cut corners on the most basic levels of care. What really gets me is the financial side of this. In 2026, we are seeing a massive push for financial transparency, led by states like New Jersey. They've passed laws requiring nursing homes to disclose exactly where their money goes. Why does this matter to a caregiver? Because a lot of these facilities are owned by private equity firms that use related party transactions to hide their profits. They might pay a management fee to another company they own, or they might rent the building from their own real estate company at an inflated price. They tell the state they are broke and can't afford to hire more nurses, while the owners are pulling millions of dollars out of the back door. New Jersey is finally forcing them to show the receipts, but in most other states, the money is still a black box. If you're touring a home, ask the administrator, who actually owns this building, and what is your profit-sharing model? It's a bold question, but in 2026, it's the only way to know if your parents' care is being sacrificed for a shareholder's dividend. I want to look at the math of 2026 care. We know the cost is rising, but so is the complexity. Because the Hospital at Home program was extended through 2030, the people who actually end up in nursing homes today are much sicker than they used to be. They need more specialized care, not less. But with the federal staffing repeal, we have a mismatch. We have sicker residents and fewer nurses. I've seen data from March 2026 showing a direct correlation between this staffing gap and a spike in resident falls. If a facility doesn't have enough aides to help people get to the bathroom, people try to go themselves, they fall, and they end up with a broken hip. In 2026, a broken hip for an 80-year-old is often the beginning of the end. It is an avoidable tragedy that starts with a paperwork change in Washington. So, how do you do a 2026 facility audit before you move your parent in? I want you to go on a tour, but I want you to go at 7 p.m. on a Tuesday. Don't go at 10 a.m. on a Monday when the marketing director is there and the lobby is freshly vacuumed. Go during a shift change. That's when you see the real facility. I want you to ask 5 specific questions that go past the glossy brochure. First, how many registered nurses do you have on site right now at 7 o'clock at night? If the answer is none, or they are on call, that is your answer. Second, what is your actual turnover rate for nursing assistants in the last 6 months? In 2026, a high turnover rate is the #1 predictor of abuse. If the staff doesn't know the residents, they miss the small changes in behavior that signal a problem. Third question, can I see your most recent SFF candidate notification? Every home on the special focus list knows they are on it. If they tell you they don't know what that is, they are lying to you. Fourth, how do you handle the new 2026 antipsychotic medication rules? The April refresh of the star ratings tightened the rules on how homes use chemical restraints on residents with dementia. If they are still using heavy sedatives to manage wandering, instead of having enough staff to engage with the residents, you need to know that today. And fifth, what is your specific protocol for reporting an injury to the family? If they tell you they only call for major incidents, that's a red flag. You want to know about every skin tear and every missed meal. What really worries me in May 2026 is the rise of financial predators targeting nursing home residents. We've seen a spike in scams where people call residents claiming to be from the Social Security Audit Department, asking for their account numbers to verify their 2026 COLA raise. Because many residents are lonely or dealing with cognitive decline, they are the perfect targets. And since the February staffing repeal, there are fewer eyes on these residents to notice when they are spending hours on the phone with a stranger. You have to be the financial guardian. Check your parents' bank statements every single week. If you see a weird withdrawal or a change in their spending habits, you need to step in immediately. The staffing crisis isn't just a medical problem, it's a security problem. I keep coming back to the 1-year look back on financial records. If your parent is planning to use Medicaid to pay for their care, remember what we talked about in the last guide. The state is more aggressive than ever in 2026 about recovering costs. If they see that your parents' money was stolen by a scammer, they might still treat that as a transfer of assets and deny coverage. It's a double tragedy. Your parent loses their money to a criminal, and then the state punishes them by refusing to pay for their care. This is why having a caregiver contract and a clear paper trail is so vital this year. You have to prove where every dollar went, or the nursing home bill is going to end up on your doorstep. I want to talk for a minute about the staffing mandate debate that happened in March. There was a big study published in Health Affairs that proved something we've known for years. Higher staffing levels actually save nursing homes money in the long run because they have fewer lawsuits, fewer hospital readmissions, and higher occupancy rates. But the industry lobby fought it tooth and nail, claiming it would force homes to close. The government listened to the lobby instead of the research. I genuinely find it disgusting that we are prioritizing operational flexibility for private equity owners over the lives of 13,000 seniors who would have been saved by those staffing rules. It tells you exactly where the power lies in 2026. But you have power too. Your power is your choice and your voice. If enough families refuse to put their parents in one-star or two-star facilities, the market will be forced to change. If you find a facility that is doing it right, one that has kept its RNs on site despite the repeal, and one that is transparent about its finances, tell everyone you know. Give them a 5-star review on Google. Support the places that are choosing people over profits. In a year where the safety net is being shredded by bureaucrats, the only real protection we have is each other. If you are a caregiver and you're feeling the weight of this decision today, I want you to take a deep breath. You are doing a hard thing in a broken system. You are trying to be the expert on laws that change every few months, and you're trying to manage the emotional toll of your parents' decline. It's okay to feel overwhelmed, but don't let that overwhelm turn into silence. If you see something wrong in a facility, report it to the long-term care ombudsman in your state. Every state has one, and in 2026, their budgets were actually increased specifically to handle the complaints coming out of the staffing repeal. They are your allies. Use them. I want to walk through one more scenario before we wrap up. Imagine a woman named Maria who is looking for a home for her mother, Carmen. Maria sees a place in Florida that has a high-performing icon on the plan finder. It looks perfect. But Maria decides to dig deeper. She finds the April 2026 SFF candidate list and sees that this facility is on it. She calls the facility and asks about their RN staffing. The administrator gives her a vague answer about meeting all federal requirements. Maria knows that the federal requirements were gutted in February. She keeps looking. She finds a smaller non-profit home that doesn't have a gym or a fancy chef, but they have 24-hour nursing and a low turnover rate. Maria chooses the non-profit. 6 months later, her mother is thriving, while the high-performing facility is in the news for a major outbreak that they didn't have enough staff to contain. This is the difference between looking at the stars and looking at the truth. As we move through the rest of May 2026, here is your nursing home safety checklist. First, download the April 2026 SFF candidate list from the CMS website. Check if any local homes are on it. Second, use the Care Compare tool, but look specifically for the abuse icon and the health inspection letter grades G through L. Third, if you live in New Jersey or a state with new disclosure laws, ask for the related party transaction report during your tour. Fourth, visit at night or on a weekend to see the real staffing levels. Fifth, if your parent is already in a home, set up a financial guard on their bank account to prevent 2026 AI scams. The reality of 2026 is that the safety of our seniors is no longer a guarantee from the government. It is a project that we have to manage every single day. We have to be the inspectors, the auditors, and the advocates. It is a heavy lift, and it isn't fair that you have to be a healthcare policy expert just to find a safe bed for your mom. But being informed is the only way to win this game. When you know the secret list exists, you can't be tricked by a ghost directory. When you know about the staffing repeal, you know not to trust the federal requirements line. You are the navigator, and even though the system is getting more secretive, you have the tools to find the light. I really want to hear from you in the comments. Have you toured a facility lately and noticed fewer nurses? Have you had a hard time getting a straight answer about staffing ratios? And if you've used the SFF list to find a home, tell us how that process went for you. Your real-world data is the most important part of this channel. It's how we keep each other safe when the regulations fail us. Every story you share is a warning for another family and a roadmap for a better choice. Navigating the American healthcare system as you age is a full-time job, but it's the most important work you'll ever do. It's about protecting the dignity and the health of the people who raised us. It requires us to be smarter than the marketing, faster than the paperwork, and more persistent than the administrators. It's a heavy lift, but I'm going to keep digging through these CMS manuals and staffing reports to make sure you have the blueprints you need. Take a look at that SFF list this weekend. Check those Care Compare letter grades. And don't be afraid to ask the hard questions on your next tour. Protect the paperwork, verify the staffing levels with your own eyes, and always ask one better question before the next decision. You're doing a great job in a tough year, and I'm so glad you spent this time with me. I'll see you in the next guide.